Thank you so much for having me. Sorry, I got a pop-up. So my name is Dr. Laura Blinkhorn. I work at Mary Center. I am a family physician and a geriatrician, which means I specialize in the care of older adults. And what I am going to be talking about today is the rapid tests that are being distributed at senior centers that you can order from the federal government or pick up at the library. And what I hope to do is demonstrate how to use these tests and how to interpret the result, discuss when or why you might want to take those tests, and then answer any questions that you might have about these rapid tests. So before I get started, I just want to ask off the bat, are there any burning questions or confusion around these tests? Okay.
How accurate are they?
So they're pretty good. And actually, the way we interpret the results depends on how high your risk of COVID is before you start, before you take the test. So one of the big take-home messages, I think, is that these rapid tests are very good at identifying positive cases. So if your test is positive, you can be very certain that you do indeed have COVID. However, if your test is negative, especially if your suspicion for having COVID before taking the test was high, then you cannot rule out COVID definitively with these tests. Okay. And I am taking patients at Mary Center. I see patients at the Georgia Avenue Clinic, and I have a geriatrics consultation clinic at Georgia Avenue. But we have medical clinicians who are able to care for older adults at all 5 of our Mary Center locations. So the question of what to do with a positive test is a really important one. So let me walk through the 3 big scenarios that I think reasons that people take the test. 1, they have symptoms of COVID, okay? If you have symptoms of COVID, it's reasonable to take a rapid test to see if you have COVID. 2, if you have been exposed to COVID, let's say you had dinner with your granddaughter 2 days ago and find out that she was positive for COVID, that an exposure is another reason. And then the 3rd big bucket of reasons why people take tests is in anticipation of being around other people. So you're traveling, you're going to go to an event, a dinner, a funeral, a wedding, whatever. Those tend to be the 3 big reasons why people are using these rapid tests. And the question was, user error can certainly cause a false negative test. So what I'd like to do now, if it's okay, is demonstrate how to do each of these tests. Is that okay? Or are there other questions moving forward? Okay. So what I'm going to do, I'm going to show you the eye health, and I'm going to show you the Binax now. And some of the principles are the same, but the tests are subtly different. So the first step before taking the test is to check the back of the box and to make sure that the test has not expired. So eye health, on the back it says use by. Binax confusingly has 2 dates, but the top date is the use by date. And this is it. This test expires in November of 2022. So first step, make sure the test is not expired. Second step is you open it up, and these rapid test boxes contain 2 tests. So I recommend getting out the pieces of one and not sort of mixing it up, because it can be confusing if you have 2 pieces. So for eye health, there are 3 pieces that you need. There's the envelope, that's sealed envelope. There is the vial with liquid in it, and there is a Q-tip. Okay, so some people ask, what is the point of no return? When have I committed to taking the test? Once you open this envelope, you must take the test within an hour. You're allowed to look at all the pieces and figure it out, but once you have unsealed this envelope, you must take the test. So I am going to demonstrate how to do the eye health, and then I'm going to switch to the Binax. So I'm opening it, I'm passing the point of no return. And for eye health, there is a plastic piece, and it has one smaller depression for the sample, and then a larger depression where you have the results. So then what you do is you open the Q-tip at the bottom away from the plastic, and you collect the sample. And before I go on, any questions, or I just want to pause to make sure everyone's with me. So I've opened the envelope. I've committed to doing the test. Any questions before I keep going?
Could you repeat what the 2 indentations on that card are for?
Yeah. So one of them, the smaller one, is for the sample. That's where you put the sample of the fluid. And then the larger one is where the results will come out.
Okay, thank you.
Okay. So what you do is you need to have the full cotton part of the Q-tip in your nose to collect a sample. The way I do it to keep myself honest is I pinch it with my fingers right under the Q-tip. So, and then I want to feel my fingers against my nostrils. So that's the way I keep myself honest. You can also have someone watch you do it, or you can have someone do it for you to make sure it is deep enough in your nose. I would say that it is uncomfortable, but it is not painful. And you are not going all the way up into your brain or into the back of your oropharynx, okay? So it's a great question about whether the test is, you know, if the test got too hot or too cold, will it be valid or not? And there is an internal structure to make sure that the test is valid, which we'll come to. But there are 2 lines, and if the control line does not turn a darker color, which I'll show you in a minute, that means the test has, for whatever reason, it is not a valid test. And so there is an internal mechanism to make sure the test is not defective. So I'm going to demonstrate the Q-tip, and you have to do both nostrils, and you have to go 5 times. Now what I'm going to do is I'm going to shove it up front ways this way, and then I'm going to do my profile just so you get a sense of how deep the Q-tip is. So I'm pinching it so I keep myself honest. You can do it in front of a mirror. You can have a friend. So I'm going to go up, and I go 1, 2, 3, 4, 5. And then you can see this way. And it's, you know, my fingers are touching my nostril. 1, 2, 3, 4, 5. And again, it's uncomfortable. It is not painful. And then you open the vial, unscrew the vial, and dive the Q-tip down into the solution. So before I continue, any questions about collecting the sample or putting it in the solution?
Didn't the instructions say something about a specific length of time it's in your nose besides 5 rotations?
I believe it is just 5 rotations, but if you are seeing something different,
I may be misremembering.
okay, I believe that it has always been 5 rotation. And actually, let me say that each test is different, but I believe that 5 good rotations is the instruction. So I was 1, 2, 3, 4, 5, and then you switch to the other nostril. Okay, so now I have it down here and I'm going to stir it for 15. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Now, when you are withdrawing the Q-tip, the recommendation is that you pinch the plastic bottle and squeeze out the Q-tip as you are withdrawing so that you are leaving all the maximum amount of snot in the vial. Okay, so you squeeze it, you throw away the Q-tip, and then you seal up the vial. Okay, any questions about those steps? And I always sanitize my hands. I'm gonna sanitize my hands before this. Any questions before the next step?
On the squeezing, so you just pinch as you're pulling it out?
You pinch it and you withdraw. So you're pulling that sort of Q-tip cotton through your fingers to try to squeegee out all of the snot in the sample.
Okay, that part had me worried, but you just do it once. You're not like squeeze, squeeze, squeeze.
Yeah, no, it just once on the way out. Okay, so then you've tightened it, you've squeezed it, you open the top, and then you use the small depression, and you drop 1, 2, 3 drops of the solution into the plastic test receiver, and then you set a timer for 15 minutes, and you try not to peek because the results are not valid for 15 minutes. Okay. I want to demonstrate the Binax because it is slightly different. Before I do that, any questions about the test or how to interpret it, when to do it?
Are these
How do you get the 3 drops into the depression?
So remember, there is the little vial that we have, and we've stirred the Q-tip into the vial.
Mm-hmm.
We seal it, and then there are actually 2 ways of unscrewing it. The bottom way is to put the Q-tip in and to do the sample. The top one is the one you undo to do the thing, and then you turn it over, like eye drops or something, and then you drop 3 drops of the solution into the depression. Other questions?
Is this the one that we'll get if and when the government finally ships the free ones? I know it's what I got at the library.
Yes, I can't promise the brand, but they are sending out rapid tests.
Has anyone anywhere received one?
I have colleagues and friends who have received them.
That's good.
I haven't even gotten a shipping notice yet.
Okay. Other questions before I switch to the
I got
binder?
my shipping notice
Oh, incredible.
from UPS.
But the ones we get at the library are just the same. We can go ahead and use those.
Mm-hmm. Yeah.
Okay.
Okay.
Oh, except with the library, sometimes the liquid is not already in the vial.
Yes. And so I'm going to show the Binax one. And, you know, the only other thing that's caused confusion is the library does have PCR tests that you turn into the library and they send it to a lab. So there are 2 different types of library tests too, but the take-home ones are the rapid tests that you do by yourself at home in 15 minutes. Okay, so now I am going to demonstrate the Binax, which is slightly different. And so I've checked the expiration date, it's still valid. I can put out the instructions just so that I know what I'm doing. I make sure I have the 3 pieces, so the card, which is in the sealed envelope.
Excuse me,
The-
what if you don't have an expiration date on your Binax box?
All of them do. Sometimes they can be hidden. The Binax one, it's on the back. It's this back sticker. And it's confusing because there are actually 2 dates. There's a bottom date, which I think is when it's packed. And then the top date has a little, it looks like a little, you know, sand timer. And that's the expiration date. So the top one is the one that's the expiration date. Yeah, and that's true. There's only one set of instructions. So you want to discard, you know, the soiled Q-tip, but you want to make sure you don't toss out the instructions, though they are online as well. Okay, so for the Binax, there's the Q-tip again. There's the sealed envelope, and then the Binax has a little vial of liquid. So it's a different test. I'm going to open the envelope. And this one, I think you need to use scissors to open it. So just a minute, let me get my scissors. Okay. So you open it, and then the Binax is a little more complicated. It's a card that you open. The test results are on one side, and there are 2 holes, a top hole, which is slightly bigger than the bottom hole, and then an adhesive strip. Okay. So the order of operations is you open, and this one I'm not going to do for real because I want to show you the pieces and it can kind of spill. You open the solution and you drop 6 drops of fluid into the top of the card. So 1, 2, 3, 4, 5, 6 into the top hole. You lie it flat, and then you collect the sample. I'm not going to demonstrate this time, but 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Then, and this is the part that is a little more confusing, you do this flat. You have filled the top hole with liquid, and there's a little reservoir of liquid. You stick the Q-tip into the bottom hole and push it up to the top. And then you twirl it 3 times. 1, 2, 3. You do not take out the Q-tip. You unstick the card and you seal it. And then you wait for 15 minutes. You read the results at the top of the card. So any questions about that? Are you speaking? I think you might be muted.
Sorry.
Yes,
I
so
was-
Binax does need to be open within, does need to be used within an hour.
Now.
So now we're waiting. Oh, and excuse me, did you have a question?
Oh, I was gonna say, I see how the second one is more, you're more apt to make mistakes on that than the first one.
It's just a
Maybe not.
little bit confusing to insert the Q-tip into that reservoir of fluid. It's a little bit awkward, and if you kind of jostle it, you can slosh the solution out of the little reservoir. I think it's totally manageable, but it's just a
Pushing
little,
it up to join the,
yeah.
have the two
So
substances
it's,
joining together.
yeah, I mean, the reservoir extends the whole way, but they want you to push it up and then twist it. And I think it's kind of getting all of the snot into that reservoir, but it's a little more tricky.
It's not a medical term.
Yeah,
I'm sorry.
I know.
I couldn't resist. I can't
I
think of any
know.
other word for it. Goop.
Yeah. Yeah, I think the sample,
Sample, yes.
nasal discharge. Okay, so you do that. Now, let me show you an important thing.
Sorry.
So my eye health one, which I actually did, is not, I can't read it yet, but I do want to show you, it looks like it's negative, okay? So just remember, 2 lines positive, 1 line negative, no lines. If there's no line at all, that means the control did not flag. That means the test is invalid. It's damaged. The test does not work. So no lines, test doesn't work. 1 line, negative. 2 lines means positive.
And on both of these tests, is it important to keep the part that's going to show you the result, to keep it flat on the table the whole
Yeah.
time?
Both tests you should leave flat on the table for 15 minutes. Other questions?
The second test that you were showing us, where are people getting that? Is that the one that comes in the mail or?
Binax has been distributed, I think, at senior wellness centers, at libraries. It's one of the other brands that they're using. So they are in the community right now.
Okay,
But the first one is the one that the government is sending out.
I don't know that they're going to use one brand the whole time. My guess is that they're going to use multiple brands to try to meet demand. And, a lot of them have slight variation. So, even though I've demonstrated 2, it's important to know that sometimes the design varies slightly.
What was the first brand name?
It's called Eye Health.
Eye Help?
iHealth, health.
iHealth. Thank
Yeah.
you.
And the second one was Binax. Yeah,
Yeah, I was wondering what accrediting agency under I assume it's HHS, but within HHS, what agency actually accredits each of these tests?
that's a great question, and I don't know the answer to that. I don't know. I do think it's overseen by the FDA because I have read a discussion about the companies provide the information sheet, and the FDA signs off on the information sheet. And I was recently reading a journal editorial that the packaging instructions do not give clear help about how to interpret the test. In other words, the big message that if you have a high risk of COVID and a rapid test is negative, you should not feel comfortable. You have not ruled out COVID definitively. So that's, I think, one of the key messages of the rapid test.
Could I ask, do you recommend taking a second rapid test to validate it or to go straight to a genetic, whatever you call it,
The
test?
PCR test.
Molecular, yeah.
So if you have symptoms, if you have medical comorbidities, so you have heart disease, lung disease, diabetes, if you are at high risk, in other words, for complications from COVID, as you know, there are treatments available, oral antivirals, and the monoclonal antibody treatment, which is IV. Those treatments help reduce hospitalization. If you have symptoms of COVID and you think you might have it, and your rapid test is negative, I would recommend getting a PCR test immediately, because that might affect your treatment decisions. You should talk to your clinician, and if you have COVID, you might be a good candidate for treatment. The treatment works best if you get it as soon as possible. So you do not want to wait a few days, because then the treatment you might be out of the treatment window. The question is, how soon after an exposure should you take the test? 3 to 5 days.
Does that include asthma? And also, do you have oral antibodies or monoclonal antibodies at your place? I mean, do you prescribe them?
We have the oral antiviral test. So Mary Center does have oral antivirals. We do not have the monoclonal antibodies, which are IV.
Yeah, it's very difficult to get those, from what I hear.
It is very difficult because a lot of the monoclonal antibodies are ineffective against Omicron. And again, I think if you have symptoms, or you have symptoms and you know you have an exposure, I would reach out and speak with your clinician immediately, just because it's possible that you could benefit from treatment, but you need to know as soon as possible.
And the oral is like what? I can't think of the word. What would they be? What kind of oral? What's the name?
They're oral.
Antivirals. What are they?
They're kind of like, have you heard of Tamiflu? So Tamiflu is an oral medication that we give people for flu. So it's an oral pill that you take for a week. I think one is 3 times and the other is 2 times a day, and you take it after you have been diagnosed with COVID.
But I mean, like, if those are contraindicated for asthma, because I have asthma, so I can't ever have Tamiflu for
I see.
bronchitis.
Yes. So the oral antivirals, I will say, are very finicky. They have a lot of contraindications. There are a lot of commonly prescribed medications that you cannot take with a viral, antiviral medication. So it is absolutely critical that you speak with your clinician, because while some people benefit, you need to make sure that you specifically are able to take that treatment. Unfortunately, I have to go in a minute. Is there any other questions?
Yeah, where are you on Georgia Avenue exactly?
We are on,
It's a big street.
yeah, our address is 3942 Georgia Avenue.
Is it next to anything, a landmark or anything that I
We're
would know
in
where to?
Petworth, so it's in the Petworth neighborhood. We're
Petworth, okay.
2 blocks north of the Georgia Avenue yellow and green line metro.
Thank you so much. And thank you so much for demonstrating and explaining and answering all the questions
You
too.
did such a fabulous job. It was
Yes.
very clear. Thank you.
Yeah.
Well, it's absolutely a pleasure. I'm sorry that I have to hurry off.
Thank
I'm sure
you.
there are lots more questions, but thank you.
It was good of you to do this. Thank you, Dr. Blinkhorn.
Thank you.
Thank you very much. And if anyone has any further questions, I can make sure they're passed on as well.
Of course. I'm glad. I hope this was helpful. Thank you.
Thank you, Mr.
much.
Jonas, for
Thank
bringing
you.
her.